Hi again. This is Kathy Nickham, the DPC Ed Center Director and Education Director, and I have 2 o'clock, so I think we will go ahead and get started. I'd like to welcome all of you for being here today. And our topic today is medication use and the role of the pharmacist. You'll learn about how pharmacists can help you and your healthcare team with medication and management. Let's go over a couple of housekeeping things first. All of your lines are muted, but when we get to the question and answer period at the end of the session, you'll be able to unmute by doing #6 and then mute your phones back by doing *6. Or you can ask questions through the chat box, and we'll ask those at the end of the session as well. You'll also receive a copy of the link to the recording as well as the slides by email. And we encourage you to complete the feedback form at the end of the program. It will come up automatically if you are joining us by webinar. And your ideas both of what you like as well as what you'd like to see in the future would be very helpful to us. At this time, I'd like to introduce our speaker for today, Wendy St. Peter. And she's a professor at the College of Pharmacy at the University of Minnesota. She's worked for a number of years with patients who have had end-stage renal disease or the earlier stages of CKD. And her research is focused on improving medicine safety and effectiveness in those patients. She's also on the board of directors of the Kidney Health Initiative, which is a collaboration between the American Society of Nephrology and the Food and Drug Administration. So at this point, I'd like to welcome Wendy St. Peter. And Wendy, I'll let you take it from here.
Okay. Well, thank you, Kathy. And I'm really excited to have those of you on the phone today. I hope we'll have a good conversation about what your pharmacists can do and how they can work with you on helping you improve your health. And specifically, helping you manage and use your medications. So a little bit of background, and I think all of you that are on the phone today, I'm guessing that you most likely have chronic kidney disease. You may be on dialysis. Perhaps you have a kidney transplant. So you probably know everything on this slide, but just to point out that people with chronic kidney disease have oftentimes several other medical conditions besides chronic kidney disease, so hypertension, diabetes, sometimes heart disease, heart failure. And so it's very common for patients to have, on average, about 10 to 12 medications they take. That's particularly true of patients that are receiving dialysis. So oftentimes many medications are required, and many patients have several doctors that they go to. You may go to you have your nephrology doctor, your kidney doctor, you may have your diabetes doctor, a primary care doctor, and a number of others depending on those other conditions that you have. And in fact, we know from some research that most patients that have chronic kidney disease have on average 4 to 5 different doctors that prescribe medications for them. And thus it's very difficult sometimes for all those doctors to know exactly what you're taking. And then to add into that mix, we also know that many patients with chronic kidney disease also go to more than one pharmacy. So it's common, I sometimes do that myself, where you think you might get a bit lower price at one pharmacy versus another, or there might be multiple reasons. You might be getting some by mail order and some through a traditional pharmacy. But it's all these different reasons, the multiple medications, several doctors, more than one pharmacy, where all of your information on the medicines that you take are not in one place. So it can be really hard for people with CKD, their doctors and other healthcare professionals that work with you to keep track of all the medicines that you take. So all told, when you've got a lot of people yourself, you've got your healthcare professionals that are working with you that might not know exactly what you're taking, these things can lead to what we call medication therapy problems, or MTPs, as I'm going to abbreviate that throughout this presentation. So those medication therapy problems are numerous, and I'm going to go over some of the common ones, but they can reduce the good effects of the medicine that we want you to have. They can lead to safety issues, so having bad reaction to a medicine, perhaps an allergic reaction or side effect like diarrhea, or it can result in non-adherence to medicines. And the key is, when doctors prescribe medications for you, they're prescribing it for a reason, and if you don't take your medicines, oftentimes you may not achieve those health goals that you're trying to achieve. So what we want to discuss today is how pharmacists, as a member of your healthcare team, can help you, doctors, and other healthcare professionals to improve medicine use, and how you can help your healthcare professionals stay on the same page so that your medicine use can be optimized for you, again, to meet your health-related medication goals, and how your whole healthcare team can help you manage your medications. How can we keep everybody on the same page? So I wanted to talk a little bit before we go into some of those things that we can do in working as a team, but first talk a little bit more about medication therapy problems and what I mean by that. You may have different pharmacists or even physicians use different terms. Some people will call it a drug-related problem. Some may call it a medication-related problem. They're all talking about the same thing. And there are some categories of medication therapy problems that I wanted to go over with you today and what they are, so you understand more when we're talking about helping you resolve some medication therapy problems. You know what we're talking about. So there are 4 major categories, 2 of which are on this slide. And the first one is indication. That means, what is your drug for? Why are you getting that drug? We check that when we're pharmacists to make sure that you're not on any unnecessary medicines. It's pretty typical to have medicines prescribed for conditions that may be just temporary. You might be having some heartburn and you're prescribed a proton pump inhibitor or some other medication, but then that symptom goes away and you don't need that medication anymore. And I think you'd be surprised at how often those medications just keep appearing on your medication list even though you don't need them anymore. And then also, it's a responsibility for both the doctor and the pharmacist to figure out, is there other things, some symptoms or conditions that you're having that you actually need a medication for? So do you have a reason for one and you don't have one? The second thing we look for is your drug effective? Meaning, is it working the way that we want it to work for you? So we check to see, once you're on a medication, is it effective or is it not effective? Is it doing what we think it's supposed to do? And if it's not effective, we need to reevaluate to make sure that the dose of the medication is not too low. Maybe we have to increase the dose. And also, there's a number of medicines where it requires monitoring. For instance, with blood pressure medicines, when you go in for your visits, you get your blood pressure checked to see if your blood pressure medications are working. But other medicines, like, for instance, phosphate binders for dialysis patients, they take those, and one of the ways they monitor it is by checking phosphorus levels in your blood when you come in for dialysis. So as a pharmacist, we look at your medication list and we determine, do you have medications that need better monitoring or further monitoring, and we can make those kind of recommendations. We have a safety category for a medication therapy problem. So if you've taken a medication, did you have a side effect or an adverse medication reaction? Did you have an allergic reaction, or did you have diarrhea or constipation, some of those common side effects that we need to think about? Is there a better medication or another one we can use that don't have those side effects, so you're more likely to take it? Also, for kidney disease patients, as your kidney function declines, many medications are eliminated through the kidneys, and so that means with a lot of medications you may require lower doses. So what pharmacists do is, when they look at your kidney function and they look at your, your number, your GFR, they look to see if your medication dose is right. Because if it's too high, you may be having side effects and you may decide not to take that medication. So we adjust those medications. and then determine if you need some additional checking or monitoring after we make those adjustments. Then lastly, the big category is adherence. Now, adherence just means, do you take your medications as they are prescribed? And many people are not adherent to their medications because of many reasons. It could be you can't afford them. It may be that you take so many, you forget to take them, or you can't remember if you've taken them. You're out to lunch and you've forgotten to take your pill box or pills with you, so you don't have them. There's just a lot of different reasons for non-adherence, as we call it, and your pharmacist is the one that can work with you to help you overcome some of those adherence challenges to make sure you are on the medications and you can get the medications that you actually need. So a pharmacist is your friend. We are trained to find and resolve those medication therapy problems. So I wanted to let you know, I think that a lot of people have kind of their idea of what a pharmacist is, but I want to let you know that that is really changed in the past 10 years. We are educating our pharmacists not just to work behind the counter and dispense medications, but to work directly with you as a patient. Our pharmacists now have almost as many years of education as primary care physicians, because they go through 4 years of undergraduate school, 4 years of pharmacy school typically, and then oftentimes our trainees or our new pharmacists go out and they do residencies in specific areas to get more information and to work directly with patients to get more experience. So it's not uncommon for pharmacists to have 9 or 10 years beyond high school of education. And so they are really trained to be those medication experts. But I did want to let you know that different pharmacists have different levels of knowledge of chronic kidney disease, and particularly as it relates to dialysis and kidney transplant, which has some special issues that need to be considered, and not all pharmacists are actually well-versed in all of that. So I just wanted to talk about the different types of pharmacists that are out there, and maybe the perceptions that you have of pharmacists and what we are moving towards in terms of different types of pharmacists. So what I think a lot of people have experience with is our traditional pharmacist. You go to the community pharmacy, Walgreens, Walmart, CVS. You put in your prescription for your new medication. There's no privacy. You'll get counseling on that individual medication, particularly if it's a new medication, and sometimes the pharmacy will do a drug interaction check, okay? That's kind of the traditional thing. I think a lot of people think what pharmacy is all about. But we're moving towards community pharmacies that have more enhanced services. So you're going to see in some pharmacies today, you'll see actual rooms where they do private patient counseling. You may see a booth like it is on the screen right now. And these pharmacists will do extra enhanced services. You have a more private setting. They'll do things like medication reconciliation, which is creating an accurate med list, and I'm going to talk about more of that in a moment. They can help you synchronize your medications, meaning that if you have lots of medications, they make sure your refills are coming up at the same time so you're not going to the pharmacy multiple times and wasting time that way. They may do immunizations. They can do comprehensive med reviews where they have your whole medication list and take a look at it in a overall way, know what all your conditions are, and then they can help you along with your health care, your physicians, to determine whether some of those medications are needed or new ones may be needed. And then they can give you a personal med list, and you can take that away from the pharmacy. So some of our pharmacists, and particularly more independent pharmacies, are doing this, and we see these more comprehensive services more often in those independent than in the chain type of pharmacies like the Walgreens or Walmarts, but you can find that in some of those as well. There's a third type of pharmacist. Again, most of you are probably familiar with the traditional pharmacy services that we just talked about from your community pharmacy, but many people are not familiar with pharmacists that work within clinics alongside doctors and nurses, and they may or may not work in the clinic pharmacy at all. Many of them just simply see patients. The YouTube video clip that I have on this slide is of one of my colleagues, Dr. Sarah Westberg. She works in one of the clinics in our healthcare system, and she works directly with patients. She does not work in a pharmacy. I don't have the ability to show this video clip and two others that I have because we tested it yesterday and it just didn't work out, and we wanted to not have you frustrated. But I want to tell you a little bit about what you'll see. Once you get done with this presentation, I think Kathy will put those links to these YouTube video clips online, and I would really urge you to go in and look at those video clips. I think they're really will tell you and show you what pharmacists can do, and some information too about your medications, which I'll talk about in just a moment. So the video clip that is on this slide shows two patients that Dr. Westberg helped to solve their medication therapy problems. And a key to success is developing a personal relationship with your pharmacist, whether it's a community pharmacist or, like Dr. Westberg, a pharmacist that works directly in a clinic. We're teaching our pharmacy students to provide direct patient care. These MTM pharmacists bring their clinical and their medication expertise to help you figure out what medicines are best for you and are safe for you to use so you can meet those medication-related goals. Later on, this video clip features one of our primary care physicians who points out the value that pharmacists bring to the healthcare team. Physician, nurse, pharmacist, your social worker, dietitians all bring different perspectives and expertise to help you meet your overall healthcare goals. And today, again, as I point out, many of our pharmacists have as much training as primary care physicians, so they're well educated to help you do this. The next slide shows another video clip, and this is of a physician at UC San Diego Chronic Kidney Disease Program, and she talks about a third type of pharmacist that I wanted to bring to your attention, and those are your specialty pharmacists. These are pharmacists that typically have specialized training to work with patients with specific problems or conditions. There are fewer of these types of pharmacists in the U.S., but every kidney transplant center in the U.S. is required to have a person on staff that has a lot of knowledge about transplant medications, and most transplant centers fill this role with a pharmacist. Some of these pharmacists may only see patients pre-transplant to evaluate patients for medication adherence, that is, whether they'll take their immunosuppressive medication once they're done with their transplant. But most transplant centers also have pharmacists involved in the care of patients while they're in the hospital after transplant, and many have a post-transplant pharmacist involved in the transplant clinic to help patients with their transplant-related medications. But the extent of that involvement can be highly variable in different transplant centers. So if you're a transplant patient, you should ask your transplant clinic if you can meet with their pharmacist. There are also some pharmacists that specialize in the care of people with chronic kidney disease or on dialysis. That's my specialty area. And the first 2 minutes of this video clip shows a kidney doctor that talks about how patients need to be an active participant in their health. And everybody, I think, by virtue of being on this webinar today, probably most likely is already an active participant in their health because you're listening to this. But the kidney doctor focuses on the fact that your pharmacist is your friend. They can help you update your medication list. They can help you find ways to remember for you to take your medication. The doctor reminds you that you need to tell your pharmacist as well as your physicians about all the medicines that you're taking and any new medications. Kidney pharmacists can tell you if a medication is right for you and if the dose is right for your stage of CKD. They will also tell you medications that you should avoid, things like nonsteroidal anti-inflammatory drugs like ibuprofen, which is, trade names are Motrin or Advil, or things like naproxen, which is Aleve. Lastly, the next shows a video clip, and this is one of my good colleagues, Dr. Linda Adishu at the UC San Diego. She's a kidney pharmacist, similar to me, and she works in a clinic specifically with people with CKD. This video is full of good information for anyone that has CKD or is on dialysis. And some of the information will also apply to you if you have a kidney transplant. This video goes into detail about many medicines that are important in CKD. She has important information about high blood pressure medicines, diuretics, cholesterol-lowering medications, phosphate binders, and anemia medicines like iron and EPO. She also discusses things that you can do that will help you remember to take your medication. And I'll be talking a little bit about that more later. At the end of the presentation, Dr. Adishu has a quiz which you can take while you're watching the YouTube video. She explains what the right answers are for each question. And I think it's a really great way to learn about common medicines used in chronic kidney disease. So I would say I would go back and do these video clips because it can be really helpful. She also makes two really good points, which I wanted to share with you. One thing she tells you is you should use really only one pharmacy. I discussed the issue earlier on where patients use multiple pharmacies, and that means your medication-related information is in multiple places and not in one place where they can look, pharmacists can look at your total medication list. And also, when you go in to these visits, and if you have one of these visits with either an enhanced pharmacist, one that does enhanced pharmacy services, MTM pharmacist, or one of these specialty pharmacists, you want to bring in all your medications so they can sit down and look through all of them and make sure that they know exactly what you're taking. So a little bit about how to find that right pharmacist for you. So if you have a kidney transplant, the first place to look is your transplant clinic and seeing if they have a pharmacist that can work with you with your medication-related issues. You can also, if you don't have a transplant clinic pharmacist available, you can ask if your primary care clinic provides MTM services. Now, I just wanted to make a note that sometimes these services are paid for through some of the healthcare plans that you may have. Medicare doesn't typically pay for these extra MTM types of services, but several healthcare plans, Medicaid in some states, will pay for these services. So you want to check to see if your services will cover these, or your insurance will cover these, or if you'll have to pay separately. If you're on dialysis, check to see if the dialysis unit has a pharmacist they work with. Or then, like I told before with the transplant patients, ask if your primary care clinic provides MTM services and see if you can meet with that pharmacist. If neither of those are available to you, then the next location where you find a pharmacist that could work with you is probably one of these enhanced community pharmacies where they do enhanced MTM services. If you have chronic kidney disease, ask if your primary care clinic provides MTM services, and then if you don't have that available, ask if your community pharmacy provides MTM or enhanced MTM services. So what can you do to improve your medication use? I think as we've alluded to before, the first thing is have a pharmacist review all your medications. Make sure you bring all of your medications to your visit, and that means all of your prescribed medications by doctors, but also, importantly, and sometimes patients don't think of these as medications, we want you to bring your over-the-counter medications, the things like aspirin, Aleve, or Motrin, as well as any vitamins that you're taking, herbal medications, dietary supplements. And the reason we want to see those is that sometimes these types of supplements and herbal medications are not regulated by the Food and Drug Administration like your prescription drugs are. And many of these herbal medicines and some of the medication, even the dietary and herbal supplements, contain things that can be harmful to your kidneys, or they may also be eliminated through your kidneys so their levels are increased if you have kidney disease, and they can cause problems. And so it's really important for your pharmacist and your physicians to know all the different things that are really medications, not just prescribed medications that you are taking. So step one, you want to bring your medicines with you each time you meet with your pharmacist or doctor or your nurse. For instance, in the dialysis unit, oftentimes the nurses review your medications. Bring your medicines with you, including all the other things, over-the-counter medications and the herbal supplements and things as well. Step two, you need to tell them everything that you use, so you have it all with you, and exactly how you take each medication. Now, I know it's really tempting when you're talking to your doctor or your nurse or your pharmacist to just agree that you're taking it the way that it says on the bottle. But that is not in your best interest to do that, because your doctor and your pharmacist, your nurse need to know if you're not taking it the way that is prescribed, because you may not be taking the medication because you can't afford it. You may have side effects. Those are the things that we want to work with you on. We can't know and can't work with you to see if there's another medication that will work or a less expensive medication if we don't know how you're taking your medicine. And as a pharmacist that worked in the hospital setting, I saw instances where patients would come in. We had their medication list. We assumed they were taking all those medications, and then they get placed on those medications, and all of a sudden they're having side effects, like, for instance, low phosphate levels in the blood, that we had to give phosphate supplements because they weren't taking the phosphate binders the way we thought that patients were taking them. So you need to tell your practitioners that's the only way that we can help you figure out a better solution to your medications. The step three then, once we know what all your medications are, there's a process that we do called medication reconciliation and review. So I wanted to talk a little bit about medication reconciliation. That is really the process of creating the most accurate list of what you are actually taking. So the name, the dosage, the frequency, how often you're taking it, and the route. Are you taking it orally through your mouth? Are you taking an injection? Do you have a patch, a medication patch? All that information is done in a medication reconciliation. At that point, we can see if you have things that are duplicated, things that work the same way, things that are too high of a dose or low of a dose, those kind of things. Then that total medication review can take place. We know what you're taking. And then we're going to evaluate each medication for whether you have a reason to take it, an indication, if it's effective for you, is it working the way it's supposed to, is it safe in you, and are you able to take the medication? Are there some challenges to being able to take the medication? We're going to work to help you resolve that as well. Then, once you're finished with your visit, you should ask for an updated medication record to take home, so you have all those medications, and then you can share that record with all of your healthcare professional team. So I wanted to take a couple of moments to talk about how you can keep that medication list. And there's, of course, different types now. Some people, or a lot of people now, have smartphones, and there's a lot of different smartphone applications or apps out there that allow you to create a medication list, and some of them do much more than that. And I went through a lot of these for this presentation to find out the ones that are the most trustworthy. And the 4 that I have up on this slide are the ones that have been found by some pharmacy researchers to be the most trustworthy. My favorite one, though, is the MyMeds app. This is the one that I actually use. You can see when you go into your app, into your app store, you can go down and put in MyMeds, and then you see this little elephant as a reminder. That's what it is. I love this application because it does several different things. The first thing is it has pull-down screen, so you can put in the first few letters of your medicine's name, and all the different doses and things pop up, and you can choose the dose that you are taking. It gives reasons for taking the medication, so if you forgot, why you're taking the medications, it can remind you what you're taking it for. If you want to have it do this, if you have trouble remembering to take your medications, it can send out daily medication reminders either by text or emails. That's kind of an optional thing. You can choose to do it. And the most beautiful thing about this particular application is that you can share this with people that your caregivers, if you have other people that are helping you take your medications, and can share with your healthcare team. So your doctor, people at the dialysis unit, can share this list so everybody has the same information. Now, some of you may not be comfortable with using your smartphone apps and using your phone to put this information in. There are printable lists. And again, there's multitudes of printable lists out here, but I picked one that is free and it is available. I like it. The Food and Drug Administration put this list together, and really it has several of the different categories that I think are really important that give information about your medication, like what your medication's name is, what does it look like, how much are you taking, how are you using it, how frequently, and it has a column on there about start and stop dates. When people are on lots of medications, like typically people are with CKD, that it's really important for your healthcare professional team to know if you stopped a drug and why you stopped it. And so they don't start you on that same medication somewhere down the line again. And then importantly, it tells why you're using the medication as well as who to contact, so who prescribed the medication, who told you to use it in case of a herbal supplement or something like that. And that information is very helpful for your healthcare team to do. Now you can fill that form out online and you can save it so you have those medications, and then when changes are made you can simply bring up that form again and make the changes, or you can just print it out and fill it out by hand. So either option is possible. I also like this form. I'm going on to the next slide because it has really important information that everybody that's on your healthcare team should know. They should know who you are, your main contact information, any emergency contacts, who your primary care physician is if you have one, and who and which pharmacy that you go to. Again, you see there's only one space for a pharmacy. That's because we're trying to get you to think about using one pharmacy so all your medication information is one place. So when you get a new medication, there's things that you can do just to make sure that you're getting the right medication and you know how to use it. So here is a list of questions that I have on this slide that when you get a new medication, you should ask your pharmacist or your physician, both of them. So particularly your pharmacist will know a lot of this information. So what is the brand or generic name? Can I use a generic that's less costly? What is this for and how will it help me? How much do I use? Now you can read all the things on this slide, so I'm not going to go through line by line, but there is, and what I wanted to point out at the bottom of this slide, all the information that I have on this slide plus more is available in a printable brochure. Again, it's a free printable brochure by the Food and Drug Administration, and you can just print that off, and you can also include that along with your comprehensive medication list. And when you go to your pharmacist and go to your doctor and get a new medication, this will just remind you of the questions that you should ask so you know exactly why, what, where, and how to use this medication, and if you miss a dose, what to do, and all those important things. So to conclude this presentation, I hope that what I've shared today will lead you to add a pharmacist to your healthcare team, and also make sure that you, as the most important member of that healthcare team, kind of keeps that information so that everybody in your healthcare team is aware of what you're doing and how you're taking your medications and what medications you are taking. So add a pharmacist to your healthcare team. We are the medication experts. We're trained to find and resolve those medication therapy problems. We have different levels of kidney disease expertise, and just have to be aware of that. So it's important to actually, when you talk to your pharmacist, to have them to know exactly how much they know about chronic kidney disease or kidney transplant or dialysis. It's important to form a relationship with that pharmacist. We call it a therapeutic relationship, but get to know them. So when you go into the pharmacy, they recognize you. So they know how you're taking your medication. So when you get a new medication, they can alert you to any issues that they see. And those pharmacists will help you then to help you meet your medication-related goals. So love your pharmacist, and I'm here to take any questions that you have. Thanks for your attention during our presentation.
Thank you, Wendy. This is Kathy again. Yes. Please ask questions. To ask questions, remember, you can unmute your phones by doing #6 to unmute, and it sounds like we have a question. Okay, are there any questions for Wendy? #6 will unmute your phone. Okay, I don't see any questions in the chat box, and I don't hear any. Wendy, I have to say that you had a whole lot of information there and some forms that I need to go and download for myself and for my family. And I think there's a lot to do in keeping our medications straight and knowing what to take when, and I just think you have remotivated me to go back and make sure I'm doing all the things that I need to do. So thank you personally, and thank you for sharing your information with us today at the DPC Ed Center webinar.
Well, thank you for asking me. This has been a lot of fun, and I hope that everybody on the line today got some bit of information that can help them use their medications more safely and effectively in the future.
Thank you, and thank you so much, and I'm sure that that has happened. Just one last reminder, please complete the feedback form that will come up on your computer. It's very important for us to have your feedback, and I encourage all of you to join us on December 12th, which is a Wednesday next month. Originally it was planned for December 13th, so if you're signed up already, make sure that you are now signed up for December 12th, when we talk about what's so funny about kidney disease with Karen Buxman and Steve Wilson. So we hope you'll sign up on our website and join us for that as well. Again, thank you all for attending, and a special thanks again to you, Wendy, and we'll see all of you next month. Thank you.